We, the CIHSR staff, student and community, warmly welcome all of you to this very, very auspicious and landmark occasion. Today we are all gathered here to inaugurate, and have been inaugurated, the first cath lab and cardiac care center of the state of Nagaland. It was in 2005, the memorandum of understanding was signed under the bold and visionary leadership of our Chief Minister, Mr. Neiphiu, and the existence of CIHSR Society came into being. The partnership was built between the Government of Nagaland, CMC, the Lord, and Emmanuel Hospital Association, Delhi. And over last almost 15 years, the combination has been a winning one. Some of the notable achievements of this society, which runs the hospital, has been the College of Nursing, Allied Health Sciences training, and also the postgraduate program for under the DND. And in the service sector, the cancer care and the hemodialysis have made significant contribution to the state. During the COVID times, the BSL2 lab and also the COVID service, and recently included the acute care block, has been some of the notable services that has been brought to the state's health services. Our staff has worked very hard to be where we are today, and continuous quality improvement has been one of our mottos. And so today we are accredited with regards to quality with NABH. And even recently the National Accreditation Board for Laboratory has been done. And for the College of Nursing, they have been accredited by the NAC. Our theme song reads, in the chorus, this beautiful theme song was written by none other than Dr. View Meru, the Associate Director, Administration. It says, "Come every people high and low, here's meaning, healing meant for all. We have ensured that every person that works from the community, regardless of their social and economic status, they receive quality health care." The line continues saying, "Here we are, servant of the Most High, resting in His love. And it is in His love that we extend our care and compassionate care to every patient that comes here. And I'd like to compliment all the staff present here for their dedicated service." So we have tried to live up to the expectation of the state when this MOU was signed, and have made every effort to meet the needs of the people of the state. We still have a long way to go, and we hope that the government finds us worthy stewards of this big campus that has been handed over to be looked after by the CIHSR Society. And we continue to impact and improve health in the state. Sir, I think it was around 2019 when you made a surprise visit to us that the whole whisper about cath lab was being shared. And today we have seen the dream coming true, and the cath lab has been inaugurated. Dr. Avitso Leigise is the cardiologist who trained CMC Vellore, and he will be leading the department along with his team, and CMC Vellore Department of Cardiology will be mentoring the whole department.
Today we just inaugurated the Cath lab, Cardiac Care Center. The technical details of which Dr. Avitso will tell you better. I will just tell a little bit about, give you a very quick brief about CIHSR and where we stand today. So in 2005, we, like Dr. Clement just mentioned, we had signed an MOU with the state government, and our Honorable Chief Minister was then the Chief Minister, and quite an effort to get that done, but it was, I think, a step which was very important for the health of our state. So the governance structure of our hospital is that we are a society, and the key stakeholders are CMC, EHA, and the Nagaland government. The CMC Vellore is predominantly involved in training. So most of our staff, a large number of our staff, I would say about 20% of our staff are trained from Renal, formally. And then they still support us in every possible way. And what we're trying to do is get every department, each department will have a mentor department in Renal who will work with us. And so that way, then if some of us move out also, there will be continuity. EHA has about 20 hospitals in North and Northeast India, and they are extremely innovative. And they work under extreme resource constraints, and therefore they have to really be very innovative, and we learned a lot from them. And the Government of Nagaland is, of course, the key partner, and we get a tremendous amount of support, and we partner actively with the Government of Nagaland. So it's a unique PPP model which has never been tried anywhere in the country in this manner. And I think this is a good model which can be projected, and I think possibly this is the answer to the health of India. If there's any way for health to improve in the country, this is the model. Because the private sector, good quality, very expensive. Government sector has its own issues, a lot of resources. But I think if we can have a partnership like this can make a huge change in the country. And I feel that if the government can showcase a model like this in the country, this is a way to go forward. So we are about 14 years and thriving well with the active participation of all the three partners. Currently, we are 200 plus multi-speciality hospital with over 500 staff, more than 500, 561, and 120 outsourced staff. So nearing about 700 staff, and about 40% or so of our patients come from Assam, and they are increasing. And we give about 3 crores of our income every year to charity. So this is actual charity. And we started some palliative care services. Dialysis has increased to over 600 per month now, and therefore what we feel is that this is a major problem in Nagaland. We feel that we need to really develop dialysis centers all over Nagaland, in all the district centers, and we feel that this could be a good resource center for training and support to all the district hospitals in that state. We're also the largest provider of Ayushman Bharat services in Nagaland, and we hope that we can make it even more effective, so that if the really poor can be identified, then we can ensure that they get the benefit that they deserve. Currently, most of the beneficiaries are middle income, so we're not really reaching the very poor. That's where some work needs to be done. We've just been approved for a blood bank, and we hope that we can partner again with the government in getting this, mentoring other places for this. The government has a plan to develop blood banks all over the state, and we'll be happy to partner in any way possible. So our blood bank, which will be inaugurated soon, is mentored by CMC again. We have some unique services. So we have a center for children with special needs. This is a big problem in Nagaland, and we have all the faculty for it. So we're hoping that we can upgrade to a center for children with disabilities. There's nothing like that in the whole of the Northeast. And if we can do that, then I think this would make a huge difference in the entire Northeast. Because the people who are the pioneers of it are here in our state, in our hospital, and also friends in the north. So this, I think, will make a huge difference difference in the state and also in the region. Nobody is doing work there at that level. People are working with children with special needs, but not a center of training, support, and things like that at a higher level. Our cancer care center is there, it's operational now. We're doing radiotherapy, chemotherapy, and a bit of cancer surgery. We're building up our people. It's fully, it's very well manned with all the staff from CMC along. They've been trained from there, so we are reaching near saturation point, so we need to upgrade that. And what I feel is if we can get some funds for that and upgrade it, then I think in about 10 years' time, 95% of patients from Nagaland will never have to go outside. I can definitely guarantee that because I know the kind of spectrum of conditions that are there, except for things like a bone marrow transplant or say cyber knife or things like that, very high end, which possibly we might not reach in 10 years. But I think with the right amount of support, we will be able to generate the kind of manpower to be able to look after that. So that's something which, because even if you have the money, you go out, you can't get the social support that you get here. And that's so important in cancer. Our community health department has adopted 3 blocks in Dimapur, Dancing Farm, Newland to do a lot of outreach work. But now, of course, we've become districts, so we're involved in all of them with community-based rehabilitation, non-communicable diseases, cancer screening, community vision programs, mental health, etc. We are continuing to do outreach to Vinsal, Neiphiu, Peren, Jalupi, and also trying to again go to recruit. And we want to try and see how we can network as much as possible with all the districts of Nagaland. Because we have resources here. We don't have money, but we have a lot of very good people. And we want to share those resources and trainings and things like that with the rest of our state. Because, the reason why we're here is for the health of our state and not only for Dimapur. So that's something which we would like to continue to partner with as many people as possible across the state and with the government. So the government has its reaches in places, nooks and corners where nobody else can go. In academics, we now have 6 postgraduate courses under the National Board of Examination. So medicine, surgery, family medicine, and now pediatrics, and OBG and anesthesia have just been approved. So we will have 6 very soon. We also already running 4. The nursing college has completed 10 years. And 100% of the staff nurses get employed, provided they want to get employed. But if they want, looking for a job, 100%, by third year itself, they can get, we were getting campus interviews, but we stopped that because we need some of them from ourselves. But they all get into very good jobs. And we have 5 paramedical courses, 5 disciplines, and we have applied to Nagaland University for 2 more courses to be affiliated. Physiotherapy and radiotherapy. And this is one area which will expand like anything. It will become bigger than the nursing college and any other thing because we are looking at the health needs of the state and see which are the needs, and according to that we design the courses. We're also doing some non-formal courses like bedside, clinical bedside assistance, and we've been recognized by the Indian Institute of Entrepreneurship to be the official caregiving training center for elderly and home-based care. And this is the next big thing in health. So home-based care and elderly care. And a large number of people are going to need this. And so we have to quickly generate this and make it a very highly organized sector. And then in partnership with CMC Fellow, we've been doing a lot of healthcare workers training who work in very remote areas. So those are in terms of academics. We've partnered with the government in several COVID activities for the COVID hospital, awareness workshops, trainings, several education pamphlets. And, so these are things which we would like to continue to partner with the government on. We also partner with the government on all the national health programs, whether it's TB, HIV, ARSH, JSY, community health, and a lot of research and surveys for needs assessment, and training of Ayush doctors under the CHO EPIQ program, and also supporting by telemedicine to all the CHOs in Nagaland and 120 centers of the state, and health and wellness centers. And this is something which we feel is our responsibility, and that's a free support. So our plans ahead is, one is to upgrade to a cancer care center. This is really important, which will be much higher. So PET-CT, IGRT, MRI, radiotherapy, nuclear medicine. These are things which we really need urgently. And people are there. Manpower is there, no problem. This is the funds that you require for that. Center for Disability for training, treatment and support. I think we will be able to move on towards a renal transplant unit not too far off in the distant future, in the near future. And of course, something which people have all been talking about is the medical college. So we are developing a small task force to work on it. A lot of issues relating to it, finance, business plans, how it's going to run and things like that. But we've got generally a reasonable idea of how it's going to work out. So we will, once the fairly decent project proposal is there, then we will be approaching the government on this. Today, what we did was mainly relating to the Cath lab. This was sponsored under the NESIT scheme funding source. The cost is 6.48 crores, which was sanctioned. We asked for 10 CR, but it was 6.48, out of which 5.18 CR has been released, and we submitted all the utilization certificates. So we still remaining due of 1.3 crores. The facility is already fully functional. Actually, they started doing some radiotherapy already. So if we can, so a lot of our own income has to be put into that. So we need a little bit of that money to pay our suppliers and things like that. And so we're extremely thankful to the Chief Minister and his team, Mr. Venakul, for pushing it very hard through, and for the Health Department for taking this up as a priority, as a desperate need for the state. And we hope that, like Dr. Nadan said, we hope that we will be considered good stewards of the resources and the trust that has been given to us. So thank you very much, and Dr. Avitso will explain a little more about the cardiac care center.
I and the cardiac care unit team, led by Cath lab supervisor Ms. Vandana, who is sitting there with the team, would like to once again welcome you all to this special occasion. It has been a dream indeed to have a facility like this at CIHSR, and the dream was presented, as mentioned by Dr. Clement, to the Chief Minister about 2 years back when he came for a kind visit with his team. And we made a proposal of setting up a world-class cardiac care facility here at CIHSR. That would be the first of its kind in the state. We conveyed our readiness for such a high-tech unit to cater to the need for cardiac care in the state, which was sorely lacking. And it is with great pleasure today that we have been saying again and again that to see this dream come into fruition. I will take the next few minutes in updating you all to the technical aspects of the cardiac care unit and also its capabilities. I would also like to acknowledge the presence of representatives from Philips, one of the leaders in cardiac medical imaging technology, the company which has provided us with the best machines available in the world today for setting up this center for heart disease. The cardiac care unit at CIHSR is a state-of-the-art healthcare facility with the latest offering in diagnostic and therapeutic services. We are truly honored and proud to be in possession of such cutting-edge technology to enhance our services towards patient care in the state and beyond. We take this opportunity and embrace the potential to provide healthcare services that is second to none anywhere in the country. The Cath lab is at the heart of the cardiac care unit. It has the most advanced in-class S01 series ceiling mounted fluoroscopy machine, which is supported by the latest in X-ray imaging technology offered by Philips, as mentioned, the leader in cardiac imaging technology. It not only provides unparalleled visualization of cardiac structures through X-ray fluoroscopy machine, but also balances it with safe working environment for the healthcare workers as well as the patients. The unit is armed with the most advanced coronary interventional software like dynamic coronary roadmap and stent boosting technology. Now, when we say coronary, we're talking about blood vessels which supply the cardiac muscle. So, in layman's term, we say heart attacks. In heart attacks, what happens is usually one of the arteries get blocked. And so, the best treatment, most effective treatment is to enter into the coronary arteries, put wires, balloons, catheters, and open up the arteries which are blocked and re-establish supply so that there is no permanent damage to the cardiac muscle. So this is the sort of thing that a Cath lab is capable of. We also have something called the intravascular ultrasound and functional coronary assessment, also called as IFR. These are two of the most advanced coronary assessment tools available today. It makes coronary interventions a lot more meaningful and much more specific and effective. And to top this all, we also have something called the IntraSight 7 system, which is a system that integrates all these marvels of medical engineering into an integrated system for allowing smooth and coordinated coronary evaluation for the best possible outcomes. In addition to the Cath lab, we also have the Advanced Cardiac Diagnostic Unit, which is a facility which was specifically made to house some of our most advanced cardiac diagnostic machines, like 4D echocardiography for cardiac ultrasound, treadmill machine for cardiac stress testing, and Holter Monitoring machine for detecting cardiac arrhythmias. For cardiac ultrasound, we have the EPIQ 7C, which is basically a 3D ultrasound machine with the addition of real-time running images, making it a 4D cardiac structure visual experience. This unit is also massively enhanced by the Transesophageal Echocardiogram, which is, these two machines are our first installation in the state of Nagaland, and one of the few in the Northeast, by the way. This provides us with the best unmitigated sonography imaging of the heart, and also gives us the ability to gain visual access to the heart like never before. For cardiac testing, we have the GE case V6.7, which is the best-in-class cardiac stress testing machine with all the latest advanced abnormal rhythm and electrocardiographic detection algorithms that enhances our capacity to detect sudden changes during cardiac stress testing. We also have the GE Sierra 1000 Holter Monitoring device, which provides us with the capability of monitoring the heart for 48 hours at a stretch. It also has, again, the best-in-class rhythm detection algorithms for in-depth analysis of cardiac arrhythmias. We have an intensive coronary care unit, which is, again, there just next to the Cath lab for supporting critically ill patients with some of the most advanced monitoring devices available today, so that we can have the best possible outcomes for our acute cardiac patients. Henceforth, with this facility, CIHSR has the ability to deliver interventional cardiac procedures like coronary angioplasty, peripheral angioplasty, structural cardiac repair procedures for congenital heart diseases, pacemaker interventions, electrophysiology, so on and so forth. The possibilities are extensive indeed, and we are just starting to scratch the surface in this new era of advanced cardiac care. We still need to enhance our skills quite a bit to make the best use of the facility that we have here today. In conclusion, I would like to state that the cardiac care unit here at CIHSR, in the Cath lab, is truly world-class, having some of the most advanced diagnostic machines the world has to offer. It is indeed a marvelous thing to say something like that in the state of Nagaland today, but it's true, and we have it with us. This is not just the first in the state of Nagaland, but we have one of the best equipped Cath labs in the Northeast. And I would even dare say that we are not too far behind some of the best centers in the country in terms of the capabilities and facilities we have. Nagaland is not going to be too far behind the rest of the country in healthcare, I believe. And we at CIHSR are proud and honored to be part of a facility that is, I say, at the tip of the edge of cutting-edge technology in healthcare. Thank you.
And respected Dr. Sedevi Angami, the Director of CIHSR, his colleagues Dr. Avitso Leigise, Dr. Neiphiu, and other doctors and nurses, staff of the CIHSR, officers, and other medical practitioners from the town, friends from the media, ladies and gentlemen. Well, I'm delighted to be with you once again in this institution of CIHSR, and it is my privilege to have come here to inaugurate the cardiac care center is a long-awaited break, and placing this cath which will provide to the people who have these heart and other related problems. It is amazing to learn that since 2005, when the so-called referral hospital of the state was handing over to the CIHSR, and in collaboration with CMC and hospital. Over the years, we have grown by leaps and bounds, and your activities in the hospital, you have mentioned. There are so many, but you have not read the numbers, so I cannot say how many. But in addition, with today's cath lab, I think this is one of the best, I'm told, machine that is being added to. And this cath lab, the cardiology services, which is badly needed in our state. Yes, there may be other facilities in other places also, but I was told that out of the estimated population of more than 1.3 billion, across the country, about 45 million people suffer from coronary artery disease. So that means it's huge. And it may become the highest number of cases of cardiac vascular diseases in the world. This is very dangerous, and therefore, to have installed this cath lab is a huge relief for the people of the state, including the neighboring villages. We learned that the patient who comes here outside the state is about 40%, particularly from Assam. So that means we are not doing only for our state, but for neighboring states, not only in Assam but other states also. That is very comforting to learn. Now, I am privileged to have associated myself as Chief Minister from the beginning. And I wanted to see that the CIHSR grows, and we have achieved a lot, but we have more to add. And all of us, we are hoping that one day you will have a full-fledged medical college, which will give immense benefits to our state. And every year we see that so many medical students who want to go for medicine, but our quota is limited. So this time, the Russia and Ukraine, the war and bombing, we had heard that some 6 students from Nagaland is also studying in Ukraine. That means our students are desperate to study medicine. And I know, I'm aware, even few of my cousins, they are studying outside the country because they cannot get medical seats. And if this hospital come up with medical college, it will be huge revenue. We're trying our best to start a medical college in Kohima, but we are still struggling. And the infrastructure's development is okay, but the management of the hospital and the specialists, super specialists, the scientists, and other specialist people to work in our place. We wonder how it will be. Already, the hospital is taking care of a lot of people and adding these facilities. I want to congratulate the CIHSR for your initiative which you shared with me, as you mentioned, in 2019. And in short time, we had sent a proposal to the district and they could grant the money. And therefore, not wasting much time, this time we could do. So I'm also grateful to the initial donor for sanctioning and make our dream come true. The cardiac care center facilities. I have no knowledge about the lab or the medicines, but going to the hospital, observing and seeing the facilities, I think as you have mentioned, we are really assured that our CIHSR will be one of the best hospitals, healthcare unit in the state, if not the region. And I'm more delighted that the referral which you used to do, except in some extreme cases, they did not go out, but can handle here everything except few cases. That is a very good news to all of us. And so, I hope our people will take the facilities being arranged, because when a referred case is there, that it is not only the patient, it is the attendant, the family, the tension, and a lot of inconvenience, not only financial, but also cause immense inconveniences to the family. And therefore, I am extremely happy and I am grateful and I am happy that the doctors and nurses, technicians, and all the staff are doing their best. I come here and I give my comments and go. But today I had been on my mind that we need to give you more support, not in the medical sciences or equipment, but what is visible to me. And I was thinking how to create friendly environment in the hospital. You did a lot of plantations, and first you have to do your role. road with proper drainages and the footpath, and also you have to clean up the whole complex and grow hedges along the road so that all the dirty things or other which are not pleasant to the eye can be covered. So I will send my R&D engineers to visit the hospital and we will make a very nice road with footpaths and drainages. And I also sent my forest department to do plantation. Of course, you need a team, and with your support, it is possible only. So, me and my friends, we have come here and we have seen your hard working, your good job done, taking good care of the patients, and particularly during COVID-19. How you have all struggled, including government hospitals and private hospitals. And I think we got the maximum patients, particularly in the ICU and special care. I want to advise that as you are training so many people, and since you are in partnership with the government, you may not be able to reach throughout the state, but I would like the hospital to train the government nurses and staff how to take care of the hospitals and how to handle the patients or consultations through telephones also. In that way, I think where you cannot physically reach also, you can reach all nook and corner. So with this few words, my congratulations again, and I hope our people will be immensely benefited by this cardiac care center in CIHSR. And so, my best wishes to all of you. God bless.
I am here to thank our Honorable Chief Minister, his Minister colleagues, officers, and officers and officials, the press, fraternity, and our friends from town, and also our friends from here. CIHSR actually belongs to all of us. Some of us work here, and some of you are outside here. All the same, each one of us are trying to see that things work here for our people. So far, as our director has already said, this private-public partnership is working. And I think this is a very good testimony that this PPP mode of functioning is a viable system. I want to make mention that CMC law, particularly the cardiology department, headed by Dr. George Joseph, for their training, mentoring, and guiding, particularly for the establishment of this cardiac care unit. Government of Nagaland for providing the needed funds, and good to see Mr. Manukul come there, because during his tenure as Secretary Commissioner of Health, the seat was shown to establish this cardiac care center. Thank you very much, sir. And then Philippe India, where are you? We are very grateful to you for providing the best of equipment available in this country. I hope
you have not lost out in a hard negotiation. That always happens with us. And I also want to appreciate our own civil work engineers, the electrical engineers, the biomedical engineers, the information technology staff for working very hard to make that place a very delightful place. To get anything done well, there is always somebody who needs to work harder than other people. And you have done it, and so thank you very much. I want to say, you cannot like it, but I want to appreciate Dr. Sedevi. You have proved to be a good leader for us. Thank you for pushing us all the way. And we are ready for further push. Our Honorable Chief Minister will remember exactly 16 years and 2 days ago, he handed over this referral hospital to the CIHSR Society. It was 1st of March 2006. So it's exactly 16 years and 2 days. Perhaps it was about his time also. And CIHSR is a tongue twister. It's difficult for many people to pronounce. So this place is still known to many as referral hospital. Many people will simply say referral. And when they say referral, it means this. And actually, in the middle of 1980s, that was when I was still in the government, the idea that the state of Nagaland needs to have a referral hospital was perceived, and that all cases from various places within the state should be able to be taken care by the referral hospital. But I think by and by that goal, that purpose of establishing this place is being realized. Already we have several services receiving quite a lot of referrals, and if we add this cardiac care center, we will be having more referral services for people. And I think by and by, the purpose, the objective of establishing a referral hospital here will be, by God's grace, fulfilled.